Positions with us today, and I guess we'll open it up for maybe, how about an opening statement from each of you briefly, and then we'll take questions from our friends in the press.
Healthcare in this country is too expensive. The quality is good and great. If you get really sick, this is the place in the world you want to be. But it costs too much. It costs twice what the rest of the world costs per person. And the thing that we ought to do about fixing it is to increase the value we get out of the healthcare system. And if we do that, then we're going to have much better healthcare and no increase in cost. Most of the costs that we're seeing are driven because we don't manage and incentivize chronic illness. Chronic illness consumes 75% of the money that we spend on healthcare. So we need to be about preventing it. We need to incentivize prevention, wellness, and the management of chronic disease. If we do that, cost is what limits access in this country. And so if in fact we want to increase access, what we have to do is drive down cost. And none of the bills before us that have passed either the House or the Senate committees drive down costs, they drive up costs. And that's one of the reasons that people are concerned about it. It's not because they don't want us to see some changes in the healthcare model, but the fact is whether we can afford these tremendous, massive increases in costs as we try to go towards it.
And I'm John Barrasso, an orthopedic surgeon from Casper, Wyoming, practiced for 25 years. Was chief of staff of a hospital of about 125 patients, which was 125 doctors. It was the largest hospital in the state of Wyoming. My wife is a breast cancer survivor. She had 3 operations, 2 bouts of chemotherapy. We've seen it from both sides, that as a physician as well as that of a patient. I've been having meetings around Wyoming, and people there, people all around the country, are very concerned really about the cost of care and the cost of some of these proposals that we're looking at right now, at a time when we're looking at a huge debt for the nation, where there's a lot of spending, government takeovers. People are concerned that they're going to lose a number of their own rights to control their own lives with the takeover of healthcare in the nation. When I talk to people and ask them what they think about it, they so many people say, what's in it for me? And they think that the cost is going to personally cost them more, and what they're going to get in terms of their own health care, they think is going to be worse under a government-run system. And they don't want to, people nowhere want to pay more and get less. So we're continuing to travel around and listen to people. The turnouts at our town meetings have been very large. This is not something that's contrived. It is genuine, the turnouts and the concerns that are being expressed by the American people. We're fortunate to be here today. We just took a tour of this hospital. This is a beautiful facility, doing everything they can in terms of efficiencies, in terms of excellence for patients, for wonderful staff, and it just seems that you're doing the things that we would like to see done at all hospitals around the country.
Questions?
Now, today is really not a town hall type meeting, but you mentioned town hall meetings, so you have had those at other locations, and I'm wondering where you are on your itinerary here today on this tour.
Well, we were in Arkansas, West Arkansas today, had a couple hundred people at an open town hall meeting with a member of Congress there. We're also trying to meet with people who live it every day, the nurses and the doctors, to visit with them, and that's what we're doing here, as well as having community leaders, business leaders, because so much of the expense of the system, when you read these healthcare bills, is going to be put on the backs of small businesses, and those are the people, to me, that drive. That's the engine that drives the economy.
Now, the 1,000-page bill or the 1,018-page bill is the House bill. And none of us are going to have a chance to vote on that, and it's actually in 3 different committees, and they have different amendments on it. So this is now divided up. Then you have the Senate bill from the Health Committee that Tom is on, and he has not only read every page, and I'm not on this committee.
I offered 187 amendments, only one of which was accepted.
You would have liked all 187 amendments, but some people did. This is the unbound, this is the loose pages of the Health Committee bill. But this has not been bound together because they didn't want this to be out there for people to see over this August break. This was the bill originally authored by Senator Kennedy's staff. And we lost Senator Kennedy, and it's a loss to the institution, and it's a loss of half a century of a family of great tradition for our country. But this was the bill that his staff has put together and has been debated. So our thoughts and prayers, I'm sure, of everyone in this room are with the Kennedy family.
Now, John, also, when we left for the break, this bill still doesn't have a number because it hasn't been fully published, and therefore CBO, Congressional Budget, has not been able to score it. Is that correct?
Well, we have the score on it. We know. So this is $1.4 trillion over 7 years, rising at $243 billion the last year, on an increase of about 8 to 11% per year, which will raise the cost of your state's Medicaid probably about $300 million a year, at a minimum growing at a compounded 8% per year.